Can you have both ADHD and autism? What does ADHD and autism looks like together? Is ADHD comorbid with autism? Can ADHD mask autism? Can ADHD be misdiagnosed as autism? How do you know if you have ADHD or autism? Please watch the video further. We'll answer these questions after the explanations. Autism and ADHD together. Although they share many of the same symptoms, the two are distinct conditions that can affect language skills, behavior, social interactions, and the ability to learn. ADHD impacts the way the brain grows and develops, and you can have both. Yes, this is a bad news. But for many years, doctors were hesitant to diagnose a child with both ADHD and ASD. For that reason, very few medical studies have looked at the impact of the combination of conditions on children and adults. The American Psychiatric Association (APA) stated for years that the two conditions couldn't be diagnosed in the same person. In 2013, the APA changed its stance trusted source. With the release of Diagnostic and Statistical Manual of Mental Disorder 5th edition DSM-5, the APA states that the two conditions can co-occur. In a 2014 review of studies looking at the co-occurrence of ADHD and ASD, researchers found that between 30 to 50% of the people with ASD also have symptoms of ADHD. Researchers don't fully understand the cause for either condition or why they occur together so frequently. Both conditions may be linked to genetics. One study identified a rare gene that may be linked to both conditions. This finding could explain why these conditions often occur in the same person. More research is still needed to better understand the connection between ADHD and ASD. Questions: can you have both ADHD and autism? Both ADHD and ASD are more common in boys, although adults can have both ADHD and ASD. The combination is not as common as it is in children. While ASD is considered a lifelong disorder, long-term studies have shown that in 1/3 to 2/3 of children with ADHD symptoms lasts into adulthood. What does ADHD and autism look like together? Hallmarks of autism spectrum disorders and ADHD often overlap. Many autistic children also have symptoms of ADHD. Difficulties settling down, social awkwardness, ADHD comorbid with autism. The presence of comorbid ADHD and anxiety symptoms in autism spectrum disorder, clinical presentation and predictors. High rates of attention deficit hyperactivity disorder (ADHD) and anxiety symptoms have been documented in autism spectrum disorder, which is also known as ASD, and have been associated with social and adaptive impairments. Can ADHD mask autism? Attention deficit hyperactivity disorder (ADHD) may mask autism in children who have both conditions. Many of these children receive their autism diagnosis an average of 4 years later than those who have autism alone, suggests a new study. Can ADHD be misdiagnosed as autism? In the earliest stages, it's not unusual for ADHD and ASD to be mistaken for the other. Children with either condition may experience trouble communicating and focusing. Although they have some similarities, they are still two distinct conditions. How do you know if you have ADHD or autism? Children with ADHD often have difficulty paying attention to the same thing for too long, and they may get distracted easily. Autistic children may have a limited scope of interest. They may seem to obsess over things that they enjoy and have difficulty focusing on the things that they have no interest in. Thank you for watching the video. Please subscribe our channel and leave a comment if you like it.